Good afternoon, ladies and gentlemen. Dr. Parker here. This is our last week, week 12, and this week we're going to talk about first alcohol, tobacco, and other drugs problems in our community. We're going to talk about the objectives this afternoon. We want to describe attitudes about alcohol, tobacco, and other drug problems. We want to differentiate among these terms substance abuse, dependence, and addiction. We want to talk and discuss the differences among the major psychoactive drug categories, such as depressants, stimulants, marijuana. We want to talk about hallucinogens and inhalants. We want to explain the role of the nurse as it relates to the primary, secondary, and tertiary preventions of alcohol, tobacco, and other drug problems as it relates to the individual clients and their families. We want to explore the effects of substance abuse on the community and on other people within the community. So when we look at the scope of the problem, let's look at the first fact is that every culture has its beliefs and attitude about alcohol, tobacco, and other drugs, okay? These attitudes are influenced by the way society categorizes drugs as either being good or bad. So in the United States, good drugs are used or is thought of as over-the-counter or prescribed by a primary care provider, although this makes them no less problematic than addictive drugs. But addictive drugs, we consider them to be bad drugs, illegal, illicit, okay? And persons who use these drugs are considered to be criminal, regardless of whether these drugs cause any problems or not. Americans rely heavily on prescription drugs and over-the-counter drugs. They use them to release mass anxiety, for physical and emotional pain, fatigue, and we'd rather actually. What we do is we, rather than learn about non-medicinal methods of coping, okay, many people rather get that quick fix and take a pill instead of dealing with their problems or negative feelings or running to anything that we consider that can have an addictive property. So, in many cultures, people with the alcohol, and I think you're just going to start to hear me say ATOD problems are treated through the criminal justice system. Now, one of the examples in the United States is having an epidemic of drug overdose and deaths. That's what's going on now, with our biggest offenders being opiate pain relievers and heroin, ladies and gentlemen. So, however, we're going to talk about a new approach. And that new approach is going to be called the harm reduction model. It's a public health approach to ATOD problems. Our earlier countries used these approaches, and some of those earlier countries were Great Britain, the Netherlands, Germany, Switzerland, and Australia. They used this model, this public health model, and it was to help us with addiction in a health conscious way. Any psychoactive drug can be abused, and we need to understand that. Accurate information can help people make responsible decisions about drugs, and people with ATOD problems can be helped. And even though the addiction can be quite problematic, okay, we can come up with a psychoactive problematic intervention, especially education, to help us through these adverse consequences of drugs. When we look at the definitions of ATOD, considering the current phase, is that it reminds us that it is a leading drug problem that involves alcohol, tobacco, and substance abuse, issues. So, substance abuse is the use of any substance that threatens a person's health or impairs his or her social or economic functioning. So, when we talk about drug dependence, it is a psychological change in the central nervous system as a result of a chronic drug use. Okay, so then we have to consider withdrawal, which is that negative effect not having that drug brings to the person's physical and psychological person. When we talk about drug addiction, we talk about a pattern of abuse characterized by an overwhelming preoccupation with the compulsive use of a drug, securing the supply, and a high tendency for relapse of the drug is all removed, okay? And then we look at alcoholism. Alcoholism is the physical and psychological dependence on the drug alcohol. Now, although any drug, ladies and gentlemen, can be abused, but when we look at alcohol, tobacco, and other illicit drugs, these problems generally involve some kind of psychoactive drug, okay? So these drugs come in two categories. We talk about dependence and stimulants. Those are the two categories. So we look at a psychoactive drugs as drugs that affect the mood, perception, and thought, are used for the enjoyment of our social and recreational settings, and for personal use for self-medicating, physical and emotional discomfort, i.e. pain. Psychoactive drugs are divided into those categories according to their effect on our central nervous system and the general feeling or experience that this drug may bring to us, or i.e. induce. So psychoactive drugs as depressants reduce activity in the central nervous system. So it lowers the body's overall energy level, reduces sensitivity to outside stimulation, and in higher doses, induces sleep. So in general, depressants will decrease the rate. They have those side effects or those settling of the central nervous system, will reduce your respiratory rate. Your muscular coordination is somewhat slowed. Your energy level becomes dull, so the rest of your senses. Now we have to be careful because in an excessively high levels, it can lead to coma. And especially if the vital function shuts down, it leads to death. So major categories include alcohol, barbiturates, benzos, and opiates. When we talk about alcohol, we're talking about anything from beer to the top shelf liquor. When we talk about barbiturates, we're looking at things like secretol. We're looking at phenobarbital. When we're looking at benzos or benzodiazepines, we're talking about Ativan, Librium. When we're talking about those opiates that are considered depressants, we're talking about Zyprexa. We're talking about Seroquel, Haldol, and those are used, the opiates are used as and considered depressants. Psychoactive drugs that are stimulants. Stimulant drugs are used to, or what they are thought to do is to increase the central nervous system by causing a very chronic awakeness. So stimulants cause the nerve fibers to release noradrenaline and other stimulating neurotransmitters. These drugs do not give the person more energy, though. They only make them feel as if they're expending this energy kind of quickly and on their own. And it gives them a greater quantity of that normal feeling that they're looking for, i.e. nicotine, i.e. cocaine. Take a double shot of caffeine and see how you're feeling. Amphetamines, and energy drinks. Any of these drugs can be considered First of all, um, appetite suppressants and diet pills. Okay, let's think about that. So back in the day, we used to use there was a drug called Black Beauties, major diet pill. You take that medication and you were up for at least 24 to 48 hours. So of course, you lost weight, but the problem with stimulants, ladies and gentlemen, especially when you're using them for diet purposes, as soon as you stop taking them, you're going to start to gain the weight back. So they're probably not the best use for weight loss. And people like that I'm speeding through the world, feeling great and fine effect that stimulants give you. The psychoactive drug alcohol, which is one of the oldest and most widely used of these drugs, it's about 2/3 of Americans drink alcohol. We have our binge drinkers and we have our chronic drinkers. So we consider the NIAA, or the National Institute on Alcohol Abuse and Alcoholism, as one of the organizations that we use when we talk about treatment. So just for your instance, this organization publishes a clinician's guide for assessment health-related problems related to drinking. And I'll give you that address really quick. It's http://www.niaa.hih.gov/guide, and you can take a alcohol screening or drug screening to look at to see if you need assistance. So it was developed by the World Health Organization to determine if alcohol, smoking, or substance abuse is a problem, and this website will give you immediate feedback. Tobacco, on the other hand, smoking is most preventable cause of death in the United States. It is, though, up there in the top 10 for leading causes of cardiovascular disease, respiratory disease. So we have to also consider that nicotine can act as both a stimulant and depressant. We run into trouble with nicotine when we talk about the mainstream smoke, secondhand smoke, and for some reason people believe that chewing tobacco or dipping snuff products are not addictive or are not dangerous, and they're just as dangerous as tobacco, nicotine itself. Ladies and gentlemen, like I discussed last week in class, it used to be a big thing to smoke. You will have arrived. It was a rite of passage to smoke because we did not understand how smoking damaged our health. Now that we do, and especially with cancer, we are really trying to focus on not smoking. And as a matter of fact, I can tell you from someone who smoked years ago, when I stopped, I am probably one of the biggest components of people who smoke. Oh my God, you stink. And I don't want to be around you. The smoke literally makes me sick. So that's my perception of smoke now that I don't smoke. And I haven't started back because I can't get past that smell and the way I feel from people who are constantly puffing in my face. Now, ladies and gentlemen, caffeine, and I'm sure we all use it because, I mean, there's nothing better to help you feel better when you've had a night of studying and you've got to get up and go to your clinical, etc., than grabbing a energy drink. So one of the most widely used are also found in tea, soft drinks, coffee, various medications. We have to be careful to use moderate doses because high doses of this affect our health. And we can have withdrawal symptoms from caffeine. I am no better than you, and getting my doctorate, I'm telling you, I thought, oh my God, I'm going to have to withdraw from caffeine. this program was so rigorous that every day I'm going to tell you, 2 years, I know I was on a double shot of caffeine daily. We're going to start talking about illicit drug abuse. So we're going to start with our first drug, which is probably the most formidable one, which is heroin. So heroin is one of the opiates. And an opiate comes from a natural drug that's found in opium poppy. Um, Namely opium, morphine, codeine. Those things are opiates. It's synthetic in use. So, and one of our semi-synthetic drugs that we're going to start talking about is heroin. Very addictive, very dangerous, very dependent. It starts out as a recreational use and then quickly goes south and turns ugly because of the tolerance and physical dependence that's developed so quickly. Ladies and gentlemen, I've shared with you that I've worked at Arrowhead. I work at Arrowhead Behavioral Hospital, and we have two sides to our hospital. One side contains alcohol and our mental health, and the other side is all opiates. And I'm telling you, just a number of individuals, and I've had people who tell me one time they're hooked. I've had people with all walks of life, okay, that come in and want treatment, from physicians to the gentleman who did not graduate high school, and what we would call, quote unquote, scum of the earth. Okay, so withdrawal is not life threatening with heroin, but let me tell you, it is very painful for those who are withdrawing, and it is 9 times out of 10 you cannot do it alone, unless usually you're in the prison setting, because 9 times out of 10 you're going to go back out and use to get rid of the feeling that you're having. So flu-like symptoms is what has been described, but not like flu, probably the worst flu you ever had. Muscle aches, just really bad cramping, etc., and especially abdominal. Anxiety off the chart, and you want it. You want heroin. I have had people who come in, they agree to the terms of admission. This craving gets so bad, they will walk up 15 minutes later and say, I want to sign myself out. Well, it doesn't really work like that at Arrowhead, okay? So we run into a problem now. But serious complications result from this use and their unsanitary administration of drugs. You get people who live in cities under trellises and under bridges who they cannot afford the ample supplies, so they share needles, etc. And due to overdose and intoxication, these complications will occur. I cannot tell you, I've actually witnessed overdose in our lobby, from people who have come in and thought that they were going to get their fix before they came so they could start in on our medication protocol and not suffer the withdrawal symptoms like everybody else. Okay, it's a horrible withdrawal process. So cocaine cocaine is an expensive way to get high. It's not cheap like heroin, okay? And it has powerful effects on the brain, heart, and emotions. I have witnessed many individuals come in from chronic use with major heart attacks or strokes from cocaine abuse. Many users become addicted again, just like heroin, very quickly. So cocaine is a purified abstract from the coca shrub, which is found in the eastern slopes of the Andes regions of South America. It can be injected or smoked. it's a hyper stimulation. It causes that extreme alertness, that euphoria that you constantly search for. And the problem is, the reason it's so addictive because you keep chasing that euphoria that you got the first time that you're never going to get back. And feeling of confidence and power from these individuals. This drug is widely used on the street, and now can you see why? Interaction with our dopamine receptors seem to be the basis of this addiction. And so what happened was cocaine evolved into the residue and the impurities from cooking cocaine. You end up getting crack. And so crack addiction is even more rapid and more intense than cocaine could ever be. I mean, I have seen people drug down, principals, people very high powered, drugged down to the gutter using crack. Cocaine doesn't seem to have that effect because even though it's very expensive, it doesn't have that intense euphoria craving the way crack cocaine does. Amphetamines, better known as speed, is similar to cocaine, but the effects last longer and the drug is cheaper. Okay, individuals get that euphoric, intense euphoric feeling. It can be injected, snorted, or smoked. Also, you get that rush. You could just go on running for days. But when you crash, you'll fall asleep for 18 to 24 hours, like I described. Our diet pills are considered amphetamines, okay? Now, the problem with this is, ladies and gentlemen, it has a chemical structure of adrenaline. We just talked about that gives you that alertness. Users are very prone to accidents, and its use is often associated with unsafe sex practices, including exposure to STDs and AIDS. Users are prone to accidents, just like we said. The drug produces an excitement and a grandiose kind of behavior, imperviolence to danger kind of effect. So, of course, these individuals want to jump from the Empire State Building, okay? Not realizing the dangers and effects that would have on you. Okay, so let's start with our illicit drug, marijuana. To be or not to be? That is our question when it comes to marijuana. Do we legalize it? Do we don't? Okay. My thoughts are not important, but I have seen some great works with medical marijuana, especially with seizures, etc. Great work. So that's my thought on it. Now, whether for a illicit drug or recreational use, that's neither here nor there. But for cancer victims, great use with marijuana. So mostly widely used illicit drug in America. It's the biggest one. It is believed that marijuana is the start of drug addiction. Users enjoy that mild euphoria or their relaxed feeling, that intensity of their sensory perception with marijuana. But side effects include dry eyes, redness, increased appetite, dry mouth, drowsiness, mild tachycardia. None of those appear to be an issue unless it's mixed with something and gives you that hallucinogenic effect. Adverse reactions include anxiety, disorientation, and paranoia. Physiological dependence can occur with chronic use, but little is known about that. Because of the illegal status, it is not a controlled substance, and users may consume contaminated marijuana. That's the problem. We have many people who, I guess, sell it or whatever, and they cut it with different things, which makes it contaminated. So over the last 5 years, laws have been changing. Different states grow it, dispense it, etc. That's why I say to be or not to be. So when we start talking about our hallucinogens, we start talking about our street drugs that are commonly used. Our first one here is ecstasy. So these hallucinogen drugs stimulate the nervous system and produce varied changes in our perception and mood. Can cause intoxication and lead to altered perception of impaired drug judgment. You have two categories of these families: indole hallucinogens and hallucinogens that resemble the adrenaline or amphetamine that move fast, that think fast, that's fast kind of thought process and perception and mood. So we say our first one, we talk about ecstasy. We even talk about bath salts, flaca, okay? Some spices can be used, mushrooms, etc. We use these. They're usually kind of man-made and thought to have that be a process of amphetamines, and we also talk about methamphetamines, which carry on the same process in the street. I have working in, as you all know, the neuro ICU. I have been called down to do stroke assessments on individuals and come to find out they're high on meth. When they come into the emergency room, especially abuse factors, they resemble the fact that they've had sometimes a massive stroke. The Actually, the facial symptoms, the can't move the arm, the can't count, can't talk, etc. So these are very deadly, and we have to be careful because keep in mind, some people make these in the laboratory, okay? So we have to be careful. Who knows what it's mixed in with? I went to pick up my Allegra D and was told that I couldn't get it because I'd had my limit for this month. I'm like, are you kidding me? I haven't even had any this month. So now I'm a little nervous about that. So I'm going to talk to my physician. So inhalants are those substances commonly found in your household chemicals that are inhaled by drug abusers that cause that effect that they're looking for. They can come from bottles, cans, or they can be soaked in a cloth. Often among the first drugs used for children. Okay. Glue sniffers, etc. Those are different things that kids use for inhalants. It's really kind of sad to watch these children move from different things like alcohol dependence to actually inhaling different things that make you get you high, basically. So these inhalant users can get high several times in a short period of time. Depending on the dose, the user may feel slightly stimulated, may have less inhibitions, or even lose consciousness. There's a link between school performance and the use of inhalants. And I mean, you don't have to, be Einstein to figure that one out. So when we look at predisposing and contribution to these factors, so in addition to being the specific drug being used, two or more major variables can influence the particular drug experience, the set and setting. To understand these patterns of drug abuse and use, individuals have three factors to factor into this. The drug setting should be considered. So when we talk about set, it refers to the individual's use, the individual's using the drug. Okay, so the person's expectations on what should happen here. A person's chronic health may alter the drug effect. If you are predisposed to alcoholism, one of my very good friends had an issue, and she used to say to me, in reference to the use of the drug, when you talk about alcohol, one is too many and 10 drinks is not enough. So when we talk about setting, it's the influence of the physical, social, and cultural environment. Back in the day, I used to hear people refer to parties that they would have, and they would call them, come on over to the set. I'm having a setting today. And if you were into drugs, you knew what that meant. So those social conditions that influence drugs, okay, is what we're talking about. Your crew, your posse, all those individuals play a role into the set and setting. So now we want to look at ATOD prevention. So when we look at prevention, we're going to start first with our primary prevention. So harm reduction, a primary care approach to substance abuse, focuses on health promotion and disease prevention. Our primary prevention for ATOD includes, ladies and gentlemen, promotion of healthy lifestyle and resiliency factors, assisting clients to achieve optimal health, okay? And our second one is education about drugs and the guidelines for their use. Now, this is where nurses, we're going to talk about where you come in on and the effects of teaching, promoting, and facilitating people who choose those healthy lifestyles and resiliency against these drugs. This becomes a lifelong battle for these individuals. They're always better served in treatment, okay? So we have to talk about teaching assertiveness and decision-making skills. We at Arrowhead, we put them through several group sessions talking about these things. You need to change your friends and change your lifestyle. So this can help, you're one step away from using at all times, even 15 years out. So your decision-making skills and your assertiveness and staying away from these individuals in this type of environment will keep you drug-free. Teaching stress reduction and relaxation techniques. We use this a lot, especially in individuals who come into the setting and are withdrawing. So, they are really hitting rock bottom with withdrawal because it is so tempting to say, sign me out. It's better for me to get back out there and get drugs. Okay. So our education is teaching that no drug is completely safe and that any drug can be abused. Helping these individuals understand how to learn and make these informed decisions about choosing drugs and the use and maximize the potential health risks behind that. Teaching them that always tell their healthcare provider what supplements they take. Because we do, that is one of the things we do include. We do have a lot of supplements. We do use a lot of other drugs with these, with our withdrawal process and keep these on board. These people who are addicted to heroin, etc., some of them will choose several pathways. We have 2 pathways. When they come in, they can choose to withdraw on a drug that's basically heroin, but we give it, and it's drug scheduled, it's drug specific, and it has a certain amount of the drug in it to keep the withdrawal from being so horrifying. Or they can come in on another protocol, which we call usually clonidine. And this is a judgmental fact, and forgive me, but I have found over my time at Arrowhead, those individuals who really want to withdraw and are really done with heroin will not come in and use our version of heroin. They will come in and go on what we call clonidine protocol, which means the withdrawal is hell, ladies and gentlemen. But these individuals will take another process in leaving the place, and usually when they stick to this, they do extremely well. I have had, like I said, politicians. I have had people who own prominent businesses etc., come in and are abusers. Okay. So now in the secondary approach, we want to basically assess the problems here. What's going on? What is driving you to be dependent? So we need to consider that so that we can get into prevention guidelines. So we do drug testing. That's a secondary prevention. We do health risk groups. We look at the adolescent, always nowadays, usually at risk for drug abuse. Our older adults get caught up in drugs from different health issues. Um, Drug people who inject drug use or inject heroin or other drugs, we look at what we can do to as a secondary prevention. We look at drug use during pregnancy. We look at illicit drug use, period. And another big secondary intervention, especially as a community nurse, is to talk about codependence and family involvement. That is a secondary prevention along with drug testing for drug use. Okay. So by the time they come into the treatment center, ladies and gentlemen, that is a tertiary intervention. So please remember that. So detoxification, tertiary; addiction treatment, tertiary; smoking cessation programs are considered tertiary. Support groups: Alcoholics Anonymous, Al-Anon, which is the codependent group for families, Narcotics Anonymous, Pills Anonymous for people who are polysubstance abuse. So most of the time, let's consider and let's talk about this really quick. People who do drugs, 9 times out of 10, are poly drug addiction abusers. Not only do they do heroin, they smoke and they probably drink. So all of those are taken into consideration. People who overeat, Overeaters Anonymous, Gamblers Anonymous, all of those are tertiary prevention methods for the drug of choice of the individual. So, ladies and gentlemen, where is the population focused nursing or the community nurse in all this process? Because many people with alcoholism and other drug problems get lost within the healthcare system. Okay. Some of it's crazy, our rehab centers, etc., have waiting lists on individuals who can seek alternative sources. The nurse who knows the client's history, environment, and support systems and local treatment programs can offer guidance in the community if you know these substance abuse centers. Um, and that is something that we know. It's not just Arrowhead. There is Midwest. Mercy Health Partners have a big behavioral health intervention center for not only mental health, but abusive drug disorders. Many people come from all of the counties in Ohio to Arrowhead because Arrowhead takes Medicaid, and you have to meet a certain criteria that other facilities do not have. And that is something that needs to be noted in the community. What the nurse, like I said, you need to know the resources. You need to, as a population or community nurse, you need to understand brief interventions for your ATOD abuser. These abusers, you need to reduce the substance and talk about those risky behaviors that go with it. Talk about reduction in consumption, okay? We use the acronym FRAMES, and FRAMES stands for feedback, responsibility, advice, menu, and empathy, self-efficacy. You can find that, ladies and gentlemen, in box 21.4 on page 430 that talks about those brief interventions and how we get that feedback loop. So nurses are the ideal role to assist in a tertiary prevention for both the addicted person and their families. and knowing your resources, ladies and gentlemen, knowing how to interject and intervene in the family, in the intervention person's life. One of the big tertiary intervention that used to come on TV was called, I think, intervention, where the family intervened with this individual who had substance abuse and got them into rehab, etc., at basically all costs. So, ladies and gentlemen, that is a brief overview of alcohol, tobacco, and other illicit drugs. Thank you very much for listening this evening. Appreciate your listening in.